About the features of depression and the diagnostic criteria for major depression. The features of depression may be psychological or may be physical. The psychological symptoms are a low mood, you feel down, you don't enjoy anything, which is called anhedonia, lack of enjoyment in usual things, a low self-esteem. And this low self-esteem usually leads to a guilty feeling, and that might lead to a suicidal thinking. And there is a general loss of interest in the activities, and that is probably linked with the loss of enjoyment. You don't feel anything, you don't enjoy the things you did before, so you lost interest, like playing, going out, mixing with people, yeah, that sort of things. You lose interest and you don't enjoy anything at all. That is anhedonia. Lack of enjoyment is anhedonia. The physical symptoms are change in appetite. Usually the appetite goes down, but sometimes appetite may go up, and that leads to a change in weight. The sleep is disturbed. Some people have early morning waking, and some has oversleeping. There is fatigue, and the libido is usually down. What are the diagnostic criteria for major depression? The mnemonic is SIG-A caps, SIG-A caps. So there are total 8 criteria here. And one more criteria is the depressed mode. So out of this 9 criteria, you need at least 5. Out of those 9, 8 plus 1, 1 is depressed mode. You need at least 5. And depressed mode must be present. What are the 8 SIGA caps? The SIGA caps are, starting with the S, sleep disturbance. And the last S is the suicidal thinking. So 2S, sleep disturbance and suicidal thinking. Then I and G. I is lack of interest. G is a feeling of guilt. E is lack of energy or feeling fatigued. And caps, the cap is lack of concentration, lack of appetite, and sometimes appetite may be increased. And the P is psychomotor changes, can be psychomotor excitation or agitation, maybe psychomotor retardation. So you need at least 5 of those criteria, 4 from those and 1 is depressed mode, at least for 2 weeks. Then we call it a major depression. That's need treatment.